A full exam. We did that last week. We would do Perla, blah, 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 blah. We check the facial nerve, visual acuity confrontation, a visual acuity test. We would be doing all those things, and then we'd be looking at his eyes with an ophthalmoscope, right? Which I demonstrated last week. So I'll have you move over here and look at your ears in just a minute. But let me do, okay. So I neglected to do our cranial nerve 11, right? I would have had him shrug his shoulders. I'm going to put my hands and put a little pressure here, and I want you to shrug even though I'm trying to prevent you. Okay, very good. So that's a nice strong shrugging. Also, can you stick your tongue out? Okay, and wiggle your tongue back and forth. Okay, very good. Now I'm going to put this tongue depressor in your mouth, and I'm going to have you say ah. And now, what are we looking for? Remember what we were looking for last week?
Evenness of
Symmetry. We're looking for symmetry. We're looking to see that the palate goes up and down on both sides. We're looking to see that the uvula is midline. What we're also going to do is I'm going to have him keep his mouth open. I'm going to look at his teeth, lips, and gums a little bit. And this is why we need our gloves, okay? And I would probably want a light source. So if I could have you look up. All right, can you say ah? Okay, great. All right, and I'm looking around, looking all around. Don't want to choke him. Okay, everything looks great. You have seriously nice teeth. Okay.
10 years with the braces.
Yeah, wow. And you don't have like a whole, see, I'm at the age where I've got all that metal in my mouth, you know? And you've got all, whatchamacallit, ceramic, whatever it is. Okay, so I'm going to be looking here. Okay, teeth good. Now, what would we be looking for here?
Would you be looking at the
discharge of the
teeth? You want to be looking for decay. You want to be looking for gingivitis, like a lot of redness, irritation, any kind of oozing, any signs of decay, any signs of kind of, missing teeth, bad dental work. You want to be looking for any kind of abnormalities like whitish, plaquey looking things, discoloration, lesions, and anything like that. You want to start asking a bunch of questions. You want to go right to old cart. I see you have some white spots on the inside of your mouth. And then the patient answers you. And then you go into, when did you get those?
What if they didn't know about them?
Well, if they didn't know about them, then you say, well, we're going to need to follow up on this, right? Okay, and then what I'm going to do is kind of put, and some examiners will even take a 4x4 and grab the tongue, lift it up, and look back and forth. Can you put your tongue behind? Very good. Okay, everything looks really good here. Okay, so the last thing we're going to do is I'm going to take, how are we doing? We're doing pretty good, aren't we? I'm going to look in your sinuses. Yeah. I'm going to look in your sinuses. Oh, I need a little speculum thingy. See that little package down there at the end? Is there right at the end? Yeah. No. They should be... I thought I had a package of them. Yeah. Okay. Look at this. Okay, so this has a light source. So, and these are disposable.
Oh my God, you look so comfortable. I'm exhausted.
So what I'm going to do is first, we look in the ears. Now, the way it goes on is like this. Okay? All right. And in the adult, you have to kind of pull the ear up and back. Pull the ear up and back. And then, let's see. Oh, very nice. Oh, am I hurting you? It's okay. Sorry. Okay, that looks really nice. I see the eardrum. It's nice and pearly gray. You should see the cone of light. Which there's a picture of. Well, it's a 5 o'clock on one side and 7 o'clock on the other. Right. Okay. And here, I'm going to look in your other ear. All right. Oh, I'm sorry. Here. Yeah. Okay, and you do have to kind of. Oh, very nice. So I want you guys to practice with this a little bit. And then I'm not really gonna stick this up your nose, but if I was, okay, if you can just look up, okay, and you wanna just be looking for, you know, that it's kind of, it should be sort of, when you do your shadow health, I was kind of like, oh my God, has she got something going on? It seems very red to me. The sinuses look very red to me. They don't usually look that red unless you've got some kind of inflammation, but I think they're supposed to be normal. But you just want to look to make sure that they're open, and you want to make sure that the septum is midline, that you can't like see all the way up on one side but not on the other. Okay? All right. Okay.
So we hold it like this?
Yeah, you hold it up. You hold it up like that. All right, now let me see. So that is,
That's not what we're doing for our validation.
no.
The whole thing. We're just doing these things for the validation.
I'm right. I'm
Okay,
trying
alright.
to give you the benefit of a, you know, reasonably decent HENT.
Right.
Okay.
Exam.
So, okay, well, if you want to have a seat here, let's just review. I palpated your lymph nodes and I did not feel any swelling. Your head is what we call normocephalic, which means that it's normal, it's symmetrical. I don't see any, you didn't have any pain. There don't seem to be any abnormalities with your hair distribution or your skin in the area. Your thyroid was not palpable. I couldn't really feel any swollen lymph glands. Your conjunctiva, the little, you know, pink area around your lower eyes, looks nice and moist and pink. I don't see anything going on with that. And your lips, tongue, and the all the mucous membranes and everything inside your mouth, all of your teeth, everything in there looks great. And that's how you would want to be describing it to the patient when you're done. Do you have any questions for me? Okay. All right. Ta-da! How's
You're
that?
unremarkable.
You're unremarkable. Okay, so now one thing we are going to start talking about is what if you do find some things that are abnormal? This is in this area. Now I know you haven't really been introduced to nursing diagnoses very much. Have you looked at them at all? Have you talked about them like in 317?
We had a question on our test today.
Yeah, but not much, not like the.
Okay,
the
so generally, nursing diagnoses are stated in a way that defines the problem in a way that either the nurse can address it or can address it by referral. For example, referring to the provider. So one thing, what if we had found that he had dandruff, or he had psoriasis, or if he had clumps of hair falling out? We might call that impaired skin integrity, right? And what could we do about that? Let's say he has dandruff.
Educate.
Okay, but you have to be very specific.
Ask what kind of products they use at home.
Okay, determine what products I like that. Determine what products the patient uses at home. What would be,
Do you ever see a dermatologist?
very good. Have you seen a dermatologist for this? That's very good. What else? Have you tried any anti-dandruff shampoos? Do you have any pain with this? Does it come and go, or do you have it all the time? Right, well, those are more questions. But so your goal would be that the patient is going to have less, less dandruff, and then some of your interventions would be that you recommend that he use like an anti-dandruff shampoo, that he rinse the hair thoroughly prior to drying, that you see a dermatologist if it doesn't improve with a new product. Okay, now what if somebody has trouble swallowing? What if you determine that they have trouble swallowing, or you're a little suspicious that they're not really getting food down? This is risk for aspiration, right? So this is not really good. This is not really good. What would you do for this? Can you think of what
It
you
depends on the age. It's like a small kid or a young.
And to be brutally honest with you, no, it really doesn't. This is like a bad
Swallowing?
thing.
I mean, that's something
Like
the
This
for
is a
nurse
how
bad
long
can't.
thing.
first?
This is a bad thing. Risk for aspiration is never good.
But that's something the nurse can't really.
Do you guys know what aspiration means? Maybe you don't even know.
Choking.
You
No.
inhale.
It means
Into
your,
your
you mean
lungs.
stuff is going into your airway that should be going down your
Oh,
esophagus.
I thought
So-
when you swallow, do you?
This is risk for aspiration, okay, so what if what happens is that the stuff is going into the airway, what is our next step?
Chest X-ray.
Okay, so we need to assess the respiratory system, right? So we're gonna like assess the respiratory system. What are we gonna tell the patient maybe to do?
Maybe cough.
Maybe like don't eat anything for like right now until we get you referred to a, right, I'm gonna refer this to the provider. The patient might need a swallow test. We do that a lot in the hospital. The patient might need, this is probably a little beyond maybe where you guys are at this moment. But what I'm trying to illustrate is some of these things don't require a lot of sort of heavy duty intervention. And I want you to start to be thinking about what can you as a nurse do to help a patient, like Tina with her headaches. Like she says, what did she just say, that she gets them like around before her period or something?
School.
When she
When she
reads.
reads.
Okay, so when she
Study.
studies. Okay, so what can you be recommending to her?
Take breaks.
Okay, so she can take breaks from studying. What else?
You have her vision tested if it's.
Have her vision. Ding, 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 ding. Very good. Very good. Have her vision tested. She might need lenses. Isn't she complaining about blurry vision? And she's got that high blood sugar. You know she's got a problem with her vision because of her blood sugar, right? So you can educate the patient about the need to test her blood sugar regularly. Even though that sounds like a different problem, it's really not, is it? It's related. Okay, how about risk for infection? Like if you discover that your patient has a lot of sinus drainage, a lot of junk running down the back of their throat when you look in their mouth, or they've got swollen glands, okay, what can you be recommending?
Go to an allergist or ask them about allergies.
Okay, so you start asking them, like, you start asking some of these questions about, do you have allergies? Do you have seasonal allergies? And then you go to the old card. When does it happen? How long does it last? What are your symptoms? What do you do for it? If you discover that somebody does pretty well with Flonase over the counter in the fall and in the spring, then recommend that they continue to do that. If they say, oh, it's been getting worse over the last year, or I seem to be more allergic to more things, you might recommend that they go to an allergist. So it just kind of depends, right? But I want you to, okay, now what if you heard a carotid bruit or saw a jugular venous distension?
Talk to them about cholesterol and blockages and stuff.
Usually it's because of the pressure in the portal system when you have.
Well, not in the, well,
When you
okay.
have this, when you have the.
Well, okay, so carotid bruits are caused by crud in the carotid arteries. JVD, yes,
Yeah,
is going to be a
talking about
backup,
JVD.
right? But this JVD is basically heart failure caused by untreated hypertension. That's, you will learn this as you. This is the cause of all of the problems in the world. Maybe not. Yeah, untreated hypertension. Untreated hypertension. That's the biggie. So, if it's a cardiac problem, what are we going to do about this? Like if you notice
The
that.
Doppler, maybe.
What?
For the carotid root, maybe it's the atherosclerosis for the carotid.
Okay, so what are we going to do about this? What are you as a nurse going to do about this? What are you going to tell the patient? What are you going to recommend? What is your next step?
See a cardiologist.
Okay, so you might want to see a cardiologist. You might want to say to the provider, I heard a bruit. They might want to recommend a Doppler study, right? Carotid Doppler studies. What about if you see this JVD, we need a set of,
Assess his cardiovascular.
okay, so we want to look at maybe edema, peripheral edema. We want to get a blood pressure. We want to get an EKG, right? Okay, so this is very hard. This is what, your 4th week of nursing school? So this is very difficult, but this is where I want you to be going, okay? This is where I want you to be going, thinking about this. Now, you don't have to do this for your next assignment. You don't have to do this for your next assignment. But it said in your schedule that we're supposed to be talking about nursing care plans. So we're talking about it. Okay? Okay, so how are we doing? Are we good?